This presentation is about helping you recover from your bowel operation. We will explain the route to your recovery and advise you about the steps you can take to speed up your recovery. The aim is to get you back to full health as quickly as possible. As part of this process, after your operation, we will encourage you to be physically active. Research has shown that if we get you back on your feet quickly, then the chances of a successful recovery are considerably improved. Before we proceed with your operation, we will need to see you in pre-admission screening clinic. Here you will be involved in planning your care and recovery. At the clinic, you will be seen by a doctor and a team of pre-screening nurses to see if you are fit enough for the operation and to find anything unusual that will be of interest to the surgical teams. The pre-admission screening clinic presents an opportunity for you to tell us all about your individual needs and circumstances at home. It is important that you tell us as early as possible if you have any concerns about whether you will be able to manage your daily activities when you are discharged after your operation. You should also let us know if any of your social circumstances are likely to change during your admission. If you need a bowel preparation, you will be advised accordingly by the staff in the pre-admission screening clinic. Bowel preparation would mean taking laxative drinks or tablets a few days before your operation. It is important that you drink plenty of water along with these tablets or drinks. Most patients are allowed to eat normally up to 6 hours before the operation. We do advise a low residue diet. This will be explained to you on the leaflets handed to you. You can drink water, black coffee or tea without milk up to 4 hours before your operation. Many people are given an enema on the ward before the operation to clear the lower part of the bowel. A health screening questionnaire will be completed with the pre-screening nurses. Your height, weight and blood pressure will be measured. Staff will monitor your heart using an ECG and do a blood test. A chest X-ray may also be required. A doctor will then perform a physical examination. You can eat until 6 hours before your operation. You may also be given 2 carbohydrate drinks to take either at home or in the hospital. You may be advised to start a special diet before the operation. For example, some patients will be asked to eat a low-fiber diet and take Senna tablets. Your consultant will advise you on this. On the day of your operation, medical staff will complete various formalities. You will then be taken to theatre and anaesthetised. When you arrive back on the ward, you will have a drip, a catheter and possibly a drain on your abdomen. They are all temporary and will be removed within 24 to 48 hours. To aid you along to a speedy recovery, you will be given good pain relief. This may be an epidural in your back, often used by ladies during childbirth. This allows you to get out of bed more easily. Sometimes you may be given a PCA, a device that allows you to control an injection of morphine into your arm when you feel you need extra pain relief. You will also be given tablets for pain and sickness when you are able to drink. You will be allowed to eat and drink as soon as possible, so that you have more energy and your bowels recover more quickly from the operation. We would also encourage you to leave your bed and sit in a chair as soon as you feel able. Some patients can manage a short walk with help too. The nurses looking after you will encourage you to sit out of bed, gently mobilise and eat and drink. A physiotherapist will teach you a breathing technique known as deep breathing. This will reduce the chances of you developing a chest infection. We will be encouraging you to regularly practice this while on the ward. Your bladder catheter will be removed, which means you will need to walk to the toilet. High-protein drinks will be available if you don't want normal food, but can also be taken as extra calories. If you have had a stoma or bag as part of the operation, you will be seen by the specialist nursing team who will plan teaching sessions for you with the ward staff. The pain will become easier, but you will still need to take regular painkillers so that you can walk around the ward, shower and sit out for your meals. We would aim for you to take at least 3 walks today with the help of the nurses. This will be tiring and you can rest in between. You will also feel sore because of the operation, so you will need to take regular painkillers. This will continue when you go home. The nurses will discuss going home with you and planning for this to happen within the next few days. Any remaining tubes or drips will be removed, and you will be encouraged with all of the previously mentioned activities. We will encourage you to increase your physical activity by walking around. This will help your bowels to recover and reduce the bloating of your tummy. Most people are at least passing wind from their bowels by now as they recover. You may feel more comfortable when you've opened your bowels normally. You will also be eating and drinking better and your confidence will increase. Increased activity levels will reduce the chances of complications developing after surgery and will also shorten your stay in hospital. You will be seen by the surgical team on a daily basis, and they will allow you to go home if you feel confident about managing at home, you are passing wind and/or opening your bowels, you are eating and drinking as well as carrying out normal activities like getting dressed, you do not have a temperature or signs of a wound or chest infection, you are walking around the ward fairly comfortably, you are passing urine without difficulty. You are confident to manage your stoma if this applies to you. When you are discharged, you will be given tablets for a week. It is important that you continue with the painkillers until you are comfortable. This will allow you to carry out normal activities at home, such as bathing, dressing, making tea, etc.
I'll say goodbye to you. Best of luck.
Thanks,
All
Siobhan.
right, you take care.
Good
All right,
night.
goodbye.
Thank you.
Goodbye.
Thank you.
Thanks, bye now.
Bye.
In the first few days after your discharge, if you experience a worsening of your pain, develop a high temperature or feel unwell, it is important that you ring the ward and ask for advice. You will be seen routinely in the surgical clinic for follow-up care. You will continue to improve at home, but try not to do any heavy lifting for at least 3 to 4 weeks. Try to eat healthily. Foods rich in protein help you to get stronger and heal faster. These include milk, fish, meat, cheese and eggs. Complications do not happen very often, but it is important that you know what to look out for. During the first 2 weeks after surgery, if you are worried about any areas covered in this section of the video, please contact us or your GP. It is not unusual to suffer gripping pains called colic during the first week following removal of a portion of bowel. The pain usually lasts for a few minutes and will go away in between spasms. Severe pain that lasts for several hours may indicate a problem with your operation. This is a rare complication. If you have severe pain lasting more than 1 to 2 hours, or have a fever and feel generally unwell, you should seek urgent medical attention. It is not unusual for your wound to be slightly uncomfortable during the first 1 to 2 weeks. Please let us know if your wound is becoming red, swollen or painful, or starting to discharge fluid. Your bowel habit may change after your surgery and may become more loose or constipated. This should settle into a more normal pattern over a period of time. Your appetite will take time to recover after your surgery. You should eat small meals 3 or more times a day. If you have a stoma, the stoma care nurse will give you specialised advice on your dietary intake. It is important that you obtain an adequate amount of protein and calories to help your body to heal. If you are finding it difficult to eat, you may benefit from supplementing your food with 2 to 3 nutritional drinks a day, which can be prescribed by your doctor. We encourage activity from day 1 after surgery. You should plan to undertake regular exercise several times a day and gradually increase this during the 4 weeks following your operation until you are back to your normal level of activity. Taking up your hobbies as soon as possible again after surgery will also enable you to maintain your activity and will benefit your rehabilitation. The main restriction we would place on exercise or activities is that you do not undertake heavy lifting until 4 weeks following your surgery. Common sense will guide your exercise and rehabilitation. In general, if your wound is pain-free, you can undertake most activities. Many people are able to return to work within 4 weeks following their surgery. You would need to see your GP before returning to work. Do not drive until you are confident that you can do so safely. It is important that any pain has been resolved sufficiently for you to be able to perform an emergency stop and turn the wheel quickly in an emergency. If you have a problem or concern, or if you have any questions that have not been answered during the course of this video, then please contact us.